Hello, and welcome to East Tennessee News Stories. I'm Tyler Givens. This week at City Council, mental health care and $2 million for violence intervention funds. During members' reports, Councilmember Parker used her time to highlight proposed charter amendments that would give City Council more time to review the annual budget and avoid letting a coin flip decide local primary races. The proposed amendments will be on the agenda at the June 24th Council meeting. The full text is available at the link in the description below. In ordinances on second reading, the second vote for increased density along Bruin Road was delayed by consent. See last week's episode for an in-depth discussion of this development. The ordinances supporting the redevelopment of Knoxville College passed quickly with no discussion. Last week, President Leonard Adams spoke about the college's plans to create a mixed-use space, including low-income housing. Finally, the capital improvement plan was passed with a single no vote from Councilmember Parker. Parker voiced concerns about the inequities in the plan at the previous council meeting. Resolutions granting funds for urgent mental health care and violence intervention were the prime subjects of debate. Some council members expressed concerns about policy and leadership choices in these programs. We go now to Jerry Wagner of the McNabb Center explaining the mission of the new facility.
On this site, the concept and the design is having a true urgent care center at that facility, so that community would have access to physical health, urgent care, and then the McNabb Center's function will be to treat those people who have behavioral health conditions who come through that front door to the facility. And we'll treat people who would ordinarily go to an emergency room. You're talking about 8,500 people who've hit the emergency rooms in our local hospitals just in Knox County last year who have a behavioral health condition. So we're going to create a healing environment for those patients that come to and be treated on site. There's no delay in care. We'll have full medical staff 24 hours available for their care.
Okay. So how will the length of care and the care provided there be different than what's available at the BHUC?
So at our urgent care facility off Western Avenue, it is a true diversion facility. The only people who come there are people who are brought by law enforcement in a diversion effort, so they do not go to our local jails, and they get treatment in that facility, and that's typically a 24-hour stay, and then we follow them out into the community. This psychiatric facility that we're talking about will treat people as few as a few hours if that's all they need, but we can keep them for days as well. So multiple day stay at this facility. So at this facility, we think we will have upwards of 16 beds at that facility.
Okay. Do you know how many beds are in the emergency room psych unit at UT Med Center?
I don't know for a fact, but I think there are 10.
I will be supporting it, and I would hope that we will all continue to advocate, and those who are watching, those in the audience, to lobby your state legislators and the governor to accept Medicaid expansion, because it is a travesty that we do not accept it. Thank you.
I just want to say that I applaud your efforts to innovate and fill in gaps in the mental illness kind of ecosystem we have here. I think our city does a good job of recognizing gaps.
What funding is available for the continued operations of this facility?
So this will have multiple legs of funding, if you will. So there'll be a number of people who are uninsured. So we're asking the state of Tennessee to step up and provide funding for people who have no insurance. Medicaid or TennCare will be billed for these services as well. And part of our request to the governor was to have 3-year pilot funding to underwrite the losses, if you will, as any startup will have. And so we've got 3 years of subsidy to help with that. And then the local hospitals are also putting funds into this because they see the benefit for their patients.
When we had our council retreat, and we surveyed all the council members as to what we considered some of the biggest problems in Knoxville were, we all kept going back to mental health and homelessness. and that we knew if Medicaid expansion was allowed by Tennessee state, we would be able to address some of those issues. And I asked the question of a few of the nonprofit agencies that were here, including McNabb, about if there was Medicaid expansion, would they be able to serve more people? And their response was, they got it. They're fine. So I'm not voting yes on this resolution.
I would encourage you, Councilmember Singh, if you're considering to vote against it, to listen to the message of the sermon at our church this Sunday, where the message was progress, not perfection. I think that's really important. This isn't perfect. It's not going to solve the mental health challenges of our community.
I plan on abstaining on this vote, and the reason is I'm not feeling like McNabb stood up for the people that they serve.
The council voted to support the resolution, with Councilmember Singh abstaining. The next pair of resolutions were related to violence intervention. First, an application for a U.S. DOJ grant program which would provide $1.5 million in funding to the city for violence prevention efforts. Community member and gubernatorial candidate Constance Every raised concerns about the planned uses for the funds.
My name is Constance Every, 301 North Charlie Drive, Knoxville, Tennessee. I want to correct that for the record. It's not necessarily opposed, it's to raise concern. What is the concern around this is why, number one, we had to create a new role for LaKenya when she could have done this through Park. Or more importantly, the equity task force that has been assigned with the agenda of coming up with $100 million over the next 10 years. And this is the first year and we're nowhere near $10 million to stay on track for that initiative. This comes off as what it looks like, a political stunt. So that later on, when it's time to collect the black and brown and poor vote, we can wave our flags and say, look what we did for the Negroes once again of Knoxville. Yet we have had no addressal to Anthony Thompson Jr. We have had no addressal to the cops who are jumping on 8th graders over supposed marijuana odor. We have no addressal to the cop who was doing NASCAR and killed. We've had no addressal to the cop who was lied under oath. Multiple cops. We have no addressal to the reports of employees actually reporting racism that is occurring in the police department. We got too many families in pain out here, and all I do is watch you all profit over and over again from the pain, but you do nothing for the core issue. This is not acceptable. This is poor leadership. What should you do? Use the power of your pen. That's what we voted you here for. What's the difference between Republican and Democrat? Nothing. Because Indy Kincannon was torturing and terrorizing homelessness before the state Republican legislator gave her the power to do it. We have to get serious beyond this aspect. It's not jokes, it's not games, it's not funny, it's no smiles, no smirk. People are literally dying.
It was 2018 when SEED went out into the community and did surveys on what were the most pressing issues at the time. And it was gun violence that was at the top of the list. To me, this $1 million grant is moving in that direction, so that makes me happy. And then also the next item that we're going to vote on, to me, is a step in the right direction.
I heard no lies in what Constance Every said, to be honest. We just had an update on the Crime Stoppers program before the city council meeting started, and that was a tense environment. What we see happening are investments being made using the Black community as the reason to make the investments. But then when we look at the outcomes, the Black community is not who is being served. And based on the update I heard this morning, it could do a lot of harm to our communities that will end up not stopping the violence. It'll put a lot of people in jail. We'll have the war on drugs again in Knoxville. But the violence will continue. I'm hopeful that we will get this grant and that we will actually invest $1.5 million into community-based programs that can address the root causes. I'm in support of us pursuing this grant, but I have concerns, and I'll be watching closely to make sure that if this money does come into the city, that it is directed into the right places.
We haven't received the grant yet. This is just authorizing my administration to apply for the grant. And Ms. Middlebrook, if you could add any further clarification to help council understand what they're voting on.
Violence reduction strategies, proven violence reduction strategies that do take holistic approaches where they include supporting community-based organizations addressing some of the root causes involving our law enforcement community and other systems level stakeholders to address these issues. As with any grant-making process, and especially our federal grants, there are specific requirements as to what the resources can be used for, and there's really especially some specific indications around doing the work to continue to build out a comprehensive violence reduction strategy and then implementation of that work, which could involve some of the strategies that we are already proposing, as well as additional resources.
The second resolution on violence intervention provides funds to Turn Up Knox street outreach program headed by Denzel Grant in partnership with KPD and the newly formed Office of Community Safety. We go now to Mr. Grant and other supporters of the program.
Before I get started, I think one of the things I wanted to do was I had a few people come and support because I want you guys to see the people that's actually doing the work. I just don't want to be a voice, so if y'all don't mind standing up for me. These are the faces that's actually going to be doing the work. Turn Up Knox strives to interrupt cycles of gun violence in the Knoxville area. We support, equip, and empower people to create a safer and healthier community. A lot of people don't know this, but one of the greatest turning points in my life was actually getting shot. I say that to put out there that a lot of the times we focus on the homicides, we focus on the murders, not understanding the true impact that, those who are fortunate enough to survive gun violence, the continuous impact that they have in their lives. And so what are we doing to take any preventative measures to be proactive in this work? And I think that's what we're trying to do here today, is find a proactive solution.
We understand where they're coming from. We understand the situations they're in. We understand their lives. So we can address them to, maybe we can't stop all the gun violence, but we can interrupt some of the cycles, and we can kind of slow it down. You can't go out with strangers and try to change anything in an area where the people don't know you or they're not familiar with you. Like, we're familiar with these areas and the people are familiar with us, so it's easier for us to have access and try to stop some of these incidents.
My name is Nicole Daniels. And I'm the aunt of Brittany Daniels and Philip Tukey Stanford. And my niece, she was killed in a drive-by shooting at the age of 5. It was also the day of my brother's wedding day, and she was supposed to be a flower girl. Her father later passed 2 years later from gun violence. His mother passed from cancer, which was my sister, Otoya Daniels, and I raised my nephew. He also died from a gun violence, but it was self-inflicted. But what I've said and learned in these meetings, I want to be a part of.
I am an alumni of SEED's Career Readiness Program. One major problem we have today is the gun violence. Just the beginning of 2021, we watched teens, mothers, and the whole entire school see the loss of 6 teens in a span of 6 months. Our reality is our generation needs the proper resources and support. Turn Up Knox can and will help contribute to a safer and healthier community. And the solution for that is a strategic plan that we have created to help build a better community for our youth.
Again, not against, concerns. How are we going to sustain? What is the longevity plan? Because we don't need a temporary 5-second pop-up shop initiative that's going to shut down, build a lot of hope and aspiration, only to come back and be a disappointment and disparity in the end because funding ran out.
I just wanted to give Ms. Middlebrook a chance to answer some of these questions and tell us about this program, because this is pretty brand new in Knoxville, although it's been done in other cities before.
These programs will be designed to engage with individuals who are at highest risk, or sometimes what we call proven risk, of participating in violence, and also have a broader presence in the community. It is critical. One of the things that is absolutely critical in effective street outreach is that these need to be folks who are embedded in the community and have a sense of relationship and a sense of trust. But we see our opportunity here to create better pathways for collaboration and support with programs that are already existing that may be doing some of the things that would be beneficial to the population that is being served.
I was happy to hear that 80% of the money is going to pay people. Community members have been volunteering their time and doing a lot of this work. This is hard work. Most of the people who work in this field have gone through trauma themselves and deserve to get paid for the community work. I'm glad that this is a pilot program. We're going to be looking at it for a year, and I am hoping at that point, by that point, we have pulled together the the county mayor's office, all of the other key stakeholders, because it's more than just Knoxville City that needs to deal with this. The DA's office is willing to work with us, even the sheriff's department.
Director Millerbrook, could you share more details about what would the average day for one of these violence interrupters look like?
Well, that day can vary. So a lot of their time will be spent in community, engaging with members of the community, having conversations, having a presence, and building those relationships. They will, especially in kind of the early phases of the pilot, they will probably be spending a significant amount of time in some trainings to help them be better prepared to do this work, and then also supporting community events.
And will these violence interrupters be working alone or in pairs?
Mostly in teams.
And how did you reach the number of 7 violence interrupters?
So that number was kind of based on the geographic areas that are most directly impacted by violence.
The proposal also described some sort of data collection and analysis that would be pursued.
I think we'll mostly be obtaining that information, not only from the work, but also working closely with LaKenya and also working with our new chief, Noel.
And then what about the analysis?
I think we really, like I said, I don't think we can really pinpoint, and I think that's why we've decided to kind of make this a pilot phase. You know what I mean? I feel like that first year, just being as transparent as I can, we're actually going to be learning the work.
Have you been able to map out the incidents of violence that we have experienced in our city?
The Knoxville Police Department Crime Analysis Unit is very gracious in providing me with regular updates, which maps not only homicides, but also maps shooting incidents or shots fired reports and incidents that involve any type of injury.
When we approved the funding for SEED to engage in the research regarding the street outreach program, what I anticipated coming back to City Council was that report. Where is the violence happening? Who's committing it? And why? So I need that report. I need that analysis. I need to see that, that this is going to be different. This city will find Black people who aren't necessarily qualified for the job and put them there because they're loyal to city leadership. So if now we start this program and we got all this data coming in, but we don't have folks who know how to analyze that data and might analyze it incorrectly. Victims of gun violence, it's about 53% are Black men in the city. There's some statistic like that in our packet. The way we talk about it in Knoxville, you'd think it was 90%. I'm coming from a background of violence interruption work. Before I ran for City Council, I was the executive director of Peace Brigades International USA, training individuals and sending them around the world to interrupt violence without guns. We call them unarmed bodyguards. So I'm not sure. I think that we need a street outreach program, but I think Safe Haven is doing it, and they need the support. And there's tension right now between the city and Safe Haven. I don't really fully understand why. Applaud you all for caring enough to want to commit to the work over the next year, to learn about this work and to build those relationships. I'm just not convinced that's how we should start the work.
So we got to come together, community, family, city. All of us have to come together and stand together, and that's what we're talking about today. These are the commitments that we made. And is it enough? There's always more that we can do, and we're going to do it. But we have to start somewhere, and we got to stop the bleeding.
A lot of us that have been sitting around trying to figure out how we can help you. And we don't have enough money to solve all the problems we have in this community. So if there's something else we can do for you as you go along this journey and figure this out, ask us, let us know.
So we'll be watching and hoping and working with you and wishing you all the good luck. And I think it's going to work.
What a worthy endeavor. And I can't think of a more worthy list of organizations who are already doing this good work. You know, this council's talked a lot about new initiatives, new programs, but what the city does really well is invest in organizations that have been doing this good work. And if you talk to these organizations and spend hours and hours with them, what they'll tell you is that they're saving kids now.
Thank you, Councilmember Smith. Councilmember Parker.
I just had to add quickly that the insurance requirements, to me, it's creating this behemoth that's going to block out the grassroots. And the city will have created their preferred groups who all have workman's compensation insurance and directors and officers liability insurance, which my nonprofit doesn't have. These are things that are important as we begin programs to understand what could be the long-term ramifications.
Why do we have these requirements, and are they necessary? Why can't we get rid of them?
It's up to you to decide whether they're necessary, but yes, I think they're necessary because, and let's face it, we live in a world that is very litigious. We live in a country that's very litigious.
And now we leave you with highlights from the public forum.
I'm representing the Chilhowee Park Neighborhood Association about a concern that was raised in a few of our last meetings, and I'm bringing this to public forum because I didn't get email or a response to my phone calls either. We, like a lot of the neighborhoods in the area, have alleys where our trash pickup is done and where a lot of our driveways and back doors lead out to. And the concern is that those alleys are inconsistently lit. The reason for this is how the alleyways are managed, where people have to rent lights through KUB as opposed to them just being used in the normal streetlight fund that the city does. And we, like a lot of the rest of the city, experience the same sort of petty crimes that you deal with, such as car break-ins, other kinds of theft, drug activity, those sorts of things, all of which have contributed to people not always feeling safe. And I think that as long as there are these financial and logistical hurdles, we're never going to have comprehensively lit alleys, either because people won't want to pay that amount, people can't pay that amount, or because we have blighted properties or vacant properties where there is no one to pay that amount. There's a whole matrix of things that are involved with crime prevention, and I would also, second the people who said that poverty and other root causes are essential in addressing this. But you also have kind of infrastructure causes as well. 2007 U.S. Department of Justice study found that improved lighting can be a feasible, inexpensive, and effective method of reducing crime and should be included as one element of a situational crime reduction program. While I realize, again, this would cost money and involve construction by the city, I do think that it is worth considering.